Opioid crisis, a public health emergency. Welcome to our presentation on opioid crisis, an issue that is currently predominating in Canada. We appreciate your time and we hope to serve our purpose of spreading awareness to be able to make a difference in this prevailing issue. This is Megan Ziri and Jessa Marielle Ortiz, 4th year SCBS-CN students.
The opioid crisis in Canada is an emerging issue within society and causes many concerns for the overall health and well-being of the people affected by it. In this presentation, we will explore the issue and look at how nurses are affected by the issue, as well as other participants involved in the issue. Through a cultural and social analysis, we will receive a better understanding of the issue and what contributes to its reoccurrence. We will then look at the barriers faced and possible lobbying strategies that can be utilized in order to mitigate this issue. The opioid crisis within Canada is prevalent. An opioid crisis is a complex issue that is defined as a misuse or overuse of opioid medication that results in negative medical, social, and economic consequences. In Canada alone, within just over 2 years, 9,000 people have lost their lives to the opioid-related effects. According to the Government of Canada 2019, 94% of those deaths are accidental, and those aged 15 to 24 are the fastest growing population affected. Does 15 to 24-year-olds surprise you? Think about how society has maybe changed over the past decades, with which may have contributed to this. These pictures break down by province those affected by the opioid crisis. The picture on the right shows opioid-related deaths in Canada in 2019, which was 2,142. The picture on the left shows opioid-related poisoning hospitalization in 2019, which was 1,233. As you see, there were more deaths than hospital visits. Throughout this presentation, we will explore some of the possible reasons for this. The opioid crisis cannot be thought of by one contributing factor. There are a magnitude of factors that contribute to the crisis we are seeing in Canada today. Fentanyl use is a big contributing factor. According to the Government of Canada 2019, street drugs that have been laced with this powerful opioid, and because people can't see, taste, or smell fentanyl, this has been causing the concern because only a small amount is needed to kill someone. Fentanyl, though a very contributing factor to the crisis, is not the only one. Overprescribing medications, as well as criminalization, which causes people to consume in less safe ways and less safe places, as well as discourages them to call 911 for an overdose, as well as poverty, homelessness, and political resistance are also contributing factors that need to be taken into consideration. Prescription opioids is important to look at within this specific issue. Within our healthcare field, opioids are commonly used to treat pain. And when prescribed and used correctly, they are effective. However, they can produce a feeling of euphoria or a high, which can lead them to produce harm, which includes addictions, poisoning, or death, like we had just seen on the previous slides with the map of Canada. Per capita, Canada has one of the highest rates of opioid prescriptions, and in 2018, 1 in 8 people were prescribed an opioid. People have the right to pain treatment within the healthcare system, as they should. This, however, causes controversy between treating pain with opioid medication, but also considering the misuse or abuse of the medication, especially now in the opioid epidemic. In considering these thoughts, it is important not only to think about the people the opioid was prescribed to, but also the people around them. Not always are opioids that are prescribed harmful, but they can be when they start to be used for purposes other than what they were intended to, or for people who they were not prescribed to. There are multiple ways in which prescription drugs can become wrongfully used, including obtaining a prescription from a single physician and frequently getting them increased, obtaining prescription from multiple physicians, going from doctor to doctor and not disclosing that you already have a pain medication prescription, prescribing fraud, theft, street drug market, and internet sale. They might not even be using them for themselves. They could be simply selling them on the street. When I was in the mental health ward, we watched a video of this young man who kept going back and getting an increase in his opioid prescription, and then he would go out and sell these prescriptions on the street. According to the Canadian Centre on Substance Use and Addictions, other contributing factors include lack of awareness or access to alternative treatments for pain, lack of access to prescription opioids leading to illicit opioid use, lack of comprehensive care to respond to all mental and physical health needs of an individual, misunderstanding of the addictive risk of prescription opioids, poor mental health, early life experiences, trauma, lack of housing, and other social determinants of health, stigma towards substance use disorder. Research proves that there are multiple causing factors, and in order to fully understand each individual, we need to take into consideration all of these various factors and ensure we are not assigning one cause to everyone who uses opioids. With prescription opioids, some people have fallen to the misconceptions they were provided by healthcare providers. Hensley looks at the stories of multiple different people's experience. Stephen was one victim who was treated with opioids after surgery, and when he gained tolerance to them, he was only prescribed more opioids. Some were told that the medication was not addictive, and families were told that if their loved one was in pain, the medication would not become addictive.
Robbins was 32. He died of an opioid overdose after a 12-year battle with addiction that started with a workplace injury.
He began working in the construction field, and that's when he injured himself. At that point, he was prescribed opioids.
His older sister Kaylee says that was the start of his struggles.
Had he have not been prescribed that medication all those years ago, would it have led to where it ended?
While the use of opioids alone is harmful, people who use opioids can also end up using different kinds of drugs. As quoted by Compton and Blatchler, prescription opioids have been found to play a critical role in the crisis, serving as a gateway opioid to more harmful illicit opioid use. Heroin use was seen in those who had their prescription decreased, and 39% of heroin users claim their addiction started with prescription opioids. Do prescriptions lead to a bad cycle with the opioid crisis? The opioid crisis is evident within the healthcare field, so it is important we now look at how nurses and other people are involved within the current issue. As we know, nurses provide pain management all the time to patients, are in contact with people who could become addicted, are addicted, or have a history of addiction to opioids. As nurses, we must follow the code of ethics, and this includes providing safe, compassionate, ethical care to all patients. Whether they are using opioids or have never used them before, we need to treat all patients with the compassion and make sure they are all safe. Therefore, this opioid issue has a huge impact on nurses and makes them important people in the current issue. Nurses provide direct care to all their patients, and this is not inclusive to the hospital only. Nurses also work in the community where people are also affected by the opioid crisis. Nurses are at the front line of patient care and conduct first-hand assessments of pain. Therefore, nurses have lots of involvement with the current issue as they do pain assessments on their patients and implement interventions to address pain. Nurses spend a lot of time with their patients and are the ones who gather a lot of information about them. This can include history of opioid use. I just want you to think about how it is important nurses build these trusting relationships when asking about history, specifically about opioid use. Nurses are also able to monitor their patients and determine if they're using the opioids correctly. Nurses are involved with the crisis in so many ways because they have the ability to follow the patients from the beginning to the end. Nurses also play a big role in education. As nurses, we can educate patients on alternative therapies if they are experiencing pain. These alternatives can include other medications that aren't opioids, regional anesthetic, surgery, psychological therapies, rehabilitation, or physical therapy, and complementary and alternative medications. Have you ever provided an alternative pain medication for any of your patients? Was it effective? If not, did you try something else, or was the patient just prescribed a opioid? Of my clinical experience, I've never tried anything else. I just follow the orders because I don't want to argue with what is required. With that, however, I have also seen nurses not give patients who have a history of opioid addictions pain medications because they don't believe they're in pain. It's a really hard balance. Nurses also educate patients and their families on safe use, storage, and disposal on opioids. Teaching safe disposal is something important that I think is often forgotten, but as we said earlier in the presentation, is not just those who are prescribed the opioids that can be at risk for misusing them. Nurses also have involvement in harm reduction for those using opioids. According to the Canadian Nurses Association, harm reduction is public health approach for reducing the consequences of actions with an increased risk of negative health outcomes. Nurses in all settings are in contact with people using substances like opioids that are affecting their health. Harm reduction works to promote health, reduce harm, and ensure access to health care. Naloxone used for opioid overdose, methadone for opioid addiction, and buprenorphine for detoxification are all harm reduction strategies. Think about if you've ever had interactions with any of these harm reduction methods. How did it make you feel? I personally have had interactions with methadone, and I think it is becoming more common for treatment of opioid addictions. I also got my training during my current clinical rotation on naloxone and got a tool kit for it as well. When I was getting my training, they had mentioned that it's hard to keep up with the kits because so many people are using them for opioid overdoses.
A large number of participants are involved when individuals suffer from opioid-related effects. This includes both such individuals and healthcare providers that care for them in the hospital or in emergency situations. According to the Government of Canada in 2019, there have been more than 13,900 opioid-related deaths that occurred between January 2016 and June 2019. Between January 2016 and March 2019, there have been 17,050 opioid-related poisoning hospitalizations. MS has also reported opioid-related overdoses in multiple provinces and territories across Canada. Many healthcare professionals are involved, such as nurses, doctors, continuing care aides, medical laboratory technologists, pharmacists, paramedics, and first aid responders, for example, those who were trained to administer naloxone. We'll be using a social and cultural analysis to analyze the issue. This includes social stigma and social determinants of health influencing the issue. Under this includes childhood experiences, physical environments, social support and coping skills, and culture.
Social stigma has been highly influential on the opioid crisis in Canada. Those with the addiction are seen to be subjective to stigmatization by society, believing they are the ones responsible for their addiction and they are the only one, and they only have themselves to blame. They are also seen as untreatable and unable to recover. Think about how hard it would be to make a change if you had such negative thoughts towards you. There is also the association in society that only those who live on the street or are Indigenous have these problems, and no other group of people are subjected to the harmful effects of these drugs.
Individuals who have grown up in environments where opioid use was accepted were influenced and modeled to do the same by observing and interacting. Through observation and interaction, they grow up with a sense of understanding that using opioids is normal. Hence, family influence is highly strong and oftentimes can outweigh the impact of school and community on decision-making abilities. Thus, these children are highly prone to engaging in substance use and having child welfare involved compared with other children. In early adolescent years, time of identity development and increased independence from parents are prevalent. Studies show that positive parent-youth relationships that include open communication and closeness predict less drug use in high school youth. On the other hand, low monitoring of parents and close communication are associated with higher rates of drug use in high school. Parents can protect their children from initiation of substance use by being aware of where their children are, who they are with, and what they are doing during their free time. Since children are vulnerable to external influences as they are still developing their personalities, when they are aware and witness a parent's drug use, a modeling effect can occur due to a feeling of acceptance, as said previously. Witnessing a parent on drugs and multiple events often creates stress and trauma, which can disrupt their learning and development and exhibit mental and emotional disorders. Furthermore, early exposure to drugs can cause children to feel emotionally and physically neglected. Feelings of disturbances develop dysfunctional attachments in adulthood and causes poor coping mechanisms to arise, such as the use of drugs. In regards to physical environments, the key focus are alternatives which are available through physical activities beside the use of drugs. Some alternatives are opportunities for education, careers, religious engagement, and physical activities. When people don't have healthy alternatives, they tend to end up with low sense of purpose. leading to unhealthy behaviors such as drug use, then addiction. This is due to the notion that when a person loses purpose or future goals, they become undetermined and unmotivated to move on to the next step. Oftentimes, they get bored and dissatisfied with their life, so they end up using drugs to make up for their free time. When people have a strong bond with society, they stay engaged and act responsibly. In comparison with weak social bonds, people tend to lose focus and unfollow traditional rules, leaning towards unhealthy behaviors such as drug addiction. Difficult life circumstances may lead to distress, isolation, and finally addiction. People who are unable to manage stress in a healthy way are at high risk for engaging in addiction-related activities. People who present themselves as role models while being involved in addiction has a really large effect in reinforcing the behavior to others. Because when behaviors become accepted by a group or a community, it becomes a norm which is often accepted by a large group of people. In gatherings or parties are where usually social learning and peer influence is mostly observed. They are often observed in many kinds of drug use and other forms of behavior. Social norms and influences affect a person's perceived evaluation of what will make him or her acceptable or desirable. Social gatherings, people often want to be perceived as acceptable, so they often accept peer pressure and lead on to using drugs. In relation to treatment, modeling and peer norms are powerful predictors of treatment outcomes. Studies show that treatment programs that provide a social network where members are supportive of each other while practicing abstinence have more positive long-term outcomes. Two barriers to resolution are stigma and lack of alternatives to pain relief.
People would judge and make her feel invisible.
That he'd be ashamed to talk about his opioid use.
It happened to my husband.
Our daughter.
My best friend.
This story could be yours. Every day in Canada, 12 people die from an opioid overdose. The government of Canada is taking action. Help end stigma.
Stigma becomes a barrier when negative judgments and attitudes about people with substance use disorder are seen in public and client-provider interactions. It's a general belief that opioid problems are based from individual choice, which is not. As said previously, it is a result of multiple factors that are often unforeseen. Stigma creates barriers to both help-seeking decisions and disclosure, where shame and fear of being labeled as an addict keeps people from coming forward or seeking help. It causes many people to not access publicly available emergency relief kits, use supervised consumption sites, and other harm reduction strategies. This chart talks about how stigma looks and feels like, how it gets in the way, tension points in healthcare providers, and approaches to tackle stigma. Negative attitudes, labels, and demeaning acts are present in client-provider interactions. It stops patients from seeking help and contributes to an ongoing system of mistrust and avoidance of services. This results in poorer quality of care and an increase in opioid crisis rates. As healthcare providers, there are certain factors that contribute to stigmatization. This includes burnout and trauma. Some promising approaches are education and addiction, treatment and recovery, interventions that are client-focused, and building resilience to address burnout.
Think about the amount of times you've used an alternative treatment in the hospital. If you had, it was probably not a common occurrence. Another barrier to resolving the opioid crisis is that there is a lack of alternatives that can be used, and when patients are in pain, they want the fastest treatment they can get. Pain is a common reason people seek care and is something that they want treated fast. Sometimes opioids are the only option available, while other times long waits for alternatives such as physiotherapy is just too long for patients to stay in pain.
Strategies for lobbying: educating others through social media and sending a letter to the Government of Canada. By creating an educational video on YouTube, we may be able to raise awareness about stigma and reduce barriers to treatment and health and social services for people who use drugs. The YouTube video will be centralized on is 3 main points. Avoid being judgmental on what has exacerbated their misuse of opioids. There are many causes of addiction. To blame them on their addiction will change your perception and affect your quality of care as a nurse. Be genuinely empathetic. You don't know what the individual is going through and how difficult it may be. As a healthcare professional, your job is to give them the best quality of care possible and exert best efforts to help them recover. Use person-centered language. Studies show that terms such as addict, drug abuser, junkie increases stigma. Instead of these terms, as nurses, we can address them as people with a substance use disorder. Since nurses have the ability to influence policies related to drug use, we may be able to send a letter to the Government of Canada as a strategy of lobbying. The line of the letter addressed to the Government of Canada will include access to harm reduction and overdose prevention strategies such as naloxone kits and safe consumption sites. Naloxone kits available for free and without a prescription in all provinces and territories since not all are included in Canada. Increase availability of resources to treat opioid use disorders among other mental health conditions. Enhance access to alternate treatments for chronic non-cancer pain. Approve supervised consumption sites and allow provinces and territories to quickly set up overdose prevention sites to reduce harms associated with drug use and to prevent death. For a substantial time, the opioid crisis in Canada has been a prevalent issue that does not discriminate individuals based on race, age, or sex. Within just over 2 years, over 9,000 Canadians of diverse backgrounds have lost their lives due to opioid-related consequences. There are multiple factors contributing to the opioid crisis. Social stigma and various social determinants of health such as childhood experiences, physical environments, social support, and culture have a large influence on an individual's likelihood to misuse or abuse opioids. Hence, considering the vast number of factors, as nurses, we have the ethical obligation to provide safe, non-judgmental, compassionate, and competent care for patients with a substance use disorder and take part in harm reduction practices. By eradicating barriers to resolving the issue, we may help improve the quality of life and overall well-being of an immense portion of the Canadian population.
We're leaving you with 3 questions we hope you will all answer to add to our discussion about the opioid crisis. We hope that each group picks 1 question and that all 3 questions will be answered by the end of the week.
Discussion questions. Harm reduction is something nurses do for those with substance use addictions. However, this has some controversy within the healthcare field when it comes to treatment. What is the controversy? How does it further impact the addressment of the issue? How can nurses in their practice further reduce the stigma of patients with opioid addictions in order to ensure we are complying with our ethical obligations outlined in the Code of Ethics? What populations are more affected by the opioid crisis and what factors contribute to their vulnerability? How can nurses address these vulnerabilities and improve their health outcomes?